My name's Megan Hunter. I'm going to be your nurse for today. Your doctor's ordered a head-to-toe assessment. Is that okay with you?
Yes.
All right, the first thing I'm going to do is perform hand hygiene, don some gloves, and ensure privacy for my patient. Can you just tell me your name and your date of birth, please?
Stephanie Duckworth, 12/10/90.
And can I just confirm on your wristband?
Mm-hmm.
Perfect, okay. So the first thing I'm looking at when I look at my patient is, first of all, her level of consciousness. She is awake, she is oriented. I'm not worried about, her level of consciousness or anything like that. If I would use the Glasgow Coma Scale, and 8 and below would show severe brain damage, 9 to 12 is moderate, and 13 to 15 is little to no. All right. So the next thing I'm looking at is, do I notice any, she's dressed appropriately, she looks like she's well groomed, her hair is brushed, she doesn't look like I need to be concerned about her personal hygiene. So I'm gonna start by looking at her hair, or actually no, we're gonna do a neurological exam first. So do you know where you are?
Yes, I'm in Fort Valley.
Do you know why you're here?
I'm here to help you with a video for your class.
Do you know what year it is?
2021,
And can you tell me who the president is?
Joe Biden.
Okay, perfect. Now I'm gonna move into my, first I'm gonna start with her integumentary. So I'm looking at her skin, noticing the color. She doesn't appear to have any patches. If there were any birthmarks or any kind of markings that needed to be noted, this is when I would document those. So I'm looking at her hair looks healthy, it's well groomed. Her nails, there's no signs of any clubbing or anything like that. It looks like her hygiene is up to date and she's doing a good job. Her skin color is normal, and when I feel her skin temperature, it's warm, but it's not hot and it's not cold. And then, when I look at, when you think about, a patient sitting in a bed, you want to go over the Braden scale and the different things that could possibly risk skin breakdown. So what it is your risk for pressure ulcers and things like that if you were hospitalized. And things like moisture, sensitivity, mobility, all of those can affect and possibly put you at risk for pressure ulcers. But considering you're up and you're mobile, it's not a huge concern at the moment, okay?
Okay.
All right, so the next thing I'm gonna do is I'm gonna move into my head, ear, eye, nose, and throat exam. I'm looking at her head, it looks symmetrical. I'm not noticing any masses or deformities that I can see from a distance. Next, I'm gonna palpate. And I still don't feel any masses or anything that I need to be concerned about. I'm looking at her ears. Her ears are the correct size. They're symmetrical, and if I were to draw an imaginary line from the outer auricle of her ear to the outer canthus of her eye, and make that imaginary line, it does all align, so that shows me some symmetry within her face. Do you have any problems hearing at all?
No.
Okay, so I'm gonna do something called the whisper test, and you're gonna cover one ear. Do you know what I said?
Yes.
What did I say?
You're cute.
Okay, can I cover the other ear? Okay. Now what did I say?
You're cute.
Okay, perfect. So she can hear in both ears. They're equal. You never had any problems hearing, right?
No.
Okay. Next thing I'm going to move on is her eyes. So do you wear contacts or glasses?
Yes, I wear contacts.
Okay. So I would make note of that in my documentation that my patient does wear contacts. The next thing I'm looking at is her iris is green. Her pupils are both equal size. They are both 4 millimeters, which is what they would normally be. And her sclera is white. If there was a yellow color or anything to her sclera, it could signify there would be some organ damage or some organ failure. So you would want to make note of that. If everything looks good, I'm going to move into my Perla exam. So I'm going to take my light, shine it in, and I'm looking at the equality and reactiveness in her pupils. Good. Good. Okay. They're both equally reactive, not, one wasn't slower than the other. They both are the equal size. They both responded to light well. So I'm going to move into accommodation. So what I'm going to have you do is I'm going to have you look at this part of my stethoscope.
Okay.
and that plant over there, and I want you to move just with your eyes and move from here to there. Okay, looks good. And I'm gonna have you follow my pen.
Okay.
Okay. Both of her eyes are equally reactive. One doesn't seem to be slower than the other, and they're moving at the same exact time. Everything looks great. I don't notice any abnormalities. So the next thing I'm looking at is her nose. Her nose is midline, symmetrical on both sides. So I'm going to perform a nose patency test. So what I'm going to do is you're going to cover one nostril and breathe in through the other, and do the same thing on the other side. Okay, have you had any problems breathing through your nose or smelling, noticing different scents or anything like that? Okay, another test I could do at this point was to pick up whether it be peppermint or lemon or something with a obvious scent, and I could hold it under her nose and have her tell me what it is. Next thing I'm going to do is I'm going to move down and I'm looking at her lips. Her lips are a normal color, they're both moist. I'm not noticing any kind of discoloration that would show any lack of oxygen or anything like that. And if you could open your mouth for me. And her oral hygiene looks good. The inner mucosa of her mouth is moist and pink, just like it should be. And have you had any problems swallowing or anything like that? Okay, so the next thing I'm going to do is I'm going to inspect her neck and her trachea. I want to make sure her trachea is midline and it works properly. So what I'm going to have her do is I'm going to hand her this glass of water.
Okay.
I'm going to have you take a sip and I'm just going to feel you swallow. Okay. Perfect. Everything feels good. Her trachea is midline and she didn't report any kind of pain or any trouble swallowing at all. So that's good. Moving down her neck, her skin looks even. I'm not noticing any kind of problems with anything. And this could also be a point where I could check for jugular distension, but we're going to do that when we get to cardiac. So let's see, we did that, we did clubbing. All right, so the next thing I am going to do is I'm going to move on to a cardiac exam. So what I'm going to do first is, have you taken any heart medications or anything like that? Have you ever had any problems?
I have ventricular prolapse.
Okay, I'll write that in my documentation. So what I'm going to check first is for jugular distension, and I would tilt my patient back at a 45-degree angle and palpate her jugular and just make sure it's not bulging. It doesn't, I'm not seeing it pulsate or anything noticeably. So that's good. Good for you. So then I'm moving down to, I'm going to check her skin. So I want to see her fingers, and we're going to check capillary refill. So if I were to push, the color comes back in less than 3 seconds. So that's good. And this other side. Perfect, capillary refill looks good, and I'm going to check for edema. I'm not noticing any edema in her upper extremities. I'm going to move to her lower extremities. Capillary refill looks good, and I'm not noticing any edema. And same thing on the other side, looks good. Next thing I'm going to do is I'm going to auscultate for some heart sounds, okay?
Okay.
So I'm starting in the second intercostal space on her right side, and I'm in the aortic. Moving in the same intercostal space bilaterally, I'm listening to the pulmonic. Moving down to the third intercostal space, I'm at Erb's point. Moving down to the fifth intercostal space, I'm still midline and I'm listening to the tricuspid. And if I move bilaterally to the midclavicular line, I'm in the mitral. Okay. So everything looks good, everything sounds good. I didn't notice any kind of abnormal sounds or anything like that, adventitious sounds. She didn't say that she had any kind of problems with any breathing or any, she's not on any heart medications. She's never had a history of problems except for the prolapse. All right, so I'm going to start by assessing some pulses next. So I'm going to start with your radial, and then I'm gonna be comparing them bilaterally to make sure that everything's even on both sides. Okay, over here. Perfect. And her brachial. Okay, over here. Perfect. If I were to assess her carotid, it would be on either side of her neck. You never want to assess them at the same time. It could cause your patient to pass out. Her axillary is under her armpit. Femoral would be in the crease of her hip or in her groin area. Popliteal would be on the back of her knee. And I'm going to move down and I'm doing her dorsalis pedis, which I'm going to follow her big toe right up to the middle and palpate right there. Okay, comparing on the other side. Okay. And then her posterior tibial, you're going to follow it back behind this ankle bone. Okay, and on the other side. Perfect. Okay, everything looks good. Next, we're going to move into respiratory. Have you had any problems breathing, shortness of breath?
No.
No. Okay, perfect. So the first thing I'm going to do is I'm going to listen to some lung sounds.
Okay.
And I'm going to do 4 anterior, 2 lateral, and 4 posterior. Okay?
Okay.
And at each spot, I just want you to take a deep breath for me.
Okay.
Okay. Alright. Again. Okay. Again. Perfect. 2 laterally. And sorry if I'm going through. Right now I am in the right upper part of her lung. As I move bilaterally, I am in the left upper part of her lung. When I move down, I'm in the left, I'm still in the left upper part of her lung. Moving back across, I'm in the right middle part of her lung. When I go laterally, now I'm in the left lower lobe of her lung. And when moving onto the other side, I'm in the right lower lobe of the lung. The right lung has 3 lobes and the left only has 2, so you have to make sure you can check. Alright, doing the same thing on the back. I'm on the right upper part of her lung. Take a deep breath. Perfect. And down, I'm in the right lower part of her lung and take a deep breath. Awesome. On the other side, I'm in the left upper lobe of her lung. Okay. And down here, I'm in the left lower lobe of her lung. Perfect. Okay. So, what I'm going to do next, so respiratory, another thing that I can look at is clubbing in her fingernails. You would also want to look for any signs of cyanosis or anything that would show signs of oxygen deprivation. When I assessed her fingernails earlier, I'd already noticed that there was no clubbing, so that looks good. I'm going to tell you about our incentive spirometer and the importance of deep breathing.
Okay.
So, especially with corona going around, deep breathing is a really good way to expand your lungs to their full capacity. Because when you're taking, normal breaths, you're not expanding them all the way. So it helps expel any kind of mucus or any kind of buildup that does sit in your lungs, and it prevents pneumonia.
Okay.
So usually our general rule of thumb is 10 deep breaths an hour. So if you were watching TV, every commercial, just take a deep breath.
Okay.
Don't try and do them back to back because you could pass out. And
Okay.
if I show you this incentive spirometer, what I'm going to have you do is you would hold it like this. You're going to take this mouthpiece, you're going to purse it between your lips, and you're going to inhale as hard as you can.
Okay.
Not blow out. You inhale as deep as you possibly can. You want to expand those lungs as much as they can. And when a doctor prescribes something like this when you are in a hospital, he usually has a limit that he wants you to meet. But it would be the same thing. Use it, 10 times an hour, every commercial. Just take a deep breath and see how high you can get the little ball to go.
Okay.
All right. So, and you've never had any problems, shortness of breath, breathing, asthma, nothing like that?
No.
Okay, perfect. The next thing I'm going to move into is I'm going to check her I'm gonna do her abdominal exam. So what I'm gonna have you do is I'm gonna have you lay down this way. Perfect, okay. So what I'm looking at is I want to start, first of all, have you had any abdominal issues? Do you have a history of any kind of abdominal issues at all? Perfect, all right, so I need to look at the distension of the stomach at 2 angles. Okay, and from the toes. And I'm not noticing any kind of, the contour of her stomach is even and symmetrical. I'm not noticing any distension, and if you did, you would be measuring from her umbilicus out to show the level of distension. Everything looks good. Next thing I'm going to do is I'm going to auscultate first. So if you were to palpate first, you could actually activate bowel sounds that may not have been there before. So you always want to auscultate first. Okay. I'm in the right lower quadrant. Okay. So I'm moving ascending up into the right upper quadrant. Moving transversely into the left upper quadrant. Descending into the left lower quadrant. Okay. Her bowel sounds were normal. If you didn't hear a bowel sound within the first, in the first few seconds, you want to wait about 5 minutes to see if you hear a bowel sound. You always want to start in the right lower quadrant because it's where the ileocecal valve is, and that's where you will hear the first sounds. Then moving around, you want to identify how the sounds were. Were they hypoactive, hyperactive? Her sounds were normal. I didn't notice or hypoactivity. Next thing I'm going to do is I'm going to use the bell of my stethoscope, and I'm going to place it just above her umbilicus to listen to her abdominal aorta. This is where you can also see if there is an abdominal aortic aneurysm. Everything sounds normal. Next thing I'm going to do is palpate. Do you have any pain in any of the quadrants? When I was auscultating, did you feel any discomfort in any of the quadrants of your stomach?
No.
Okay, so I'm going to start by palpating. You're going to start with 2 fingers and just lightly pressing, and you let me know if you feel any pain or discomfort in any of these spots, okay?
Okay.
All right. Right lower, moving up into right upper quadrant. Bilaterally or transverse into the left upper quadrant, descending into the left lower, and back across. No pain? So the next thing I'm going to do is I'm going to take my fingers and I'm going to move in circular motions to further palpate her stomach. You let me know if anything feels tender or uncomfortable or painful. No pain or discomfort?
Feels great.
Okay, awesome. And you said you've never had any problems with any abdominal issues? When was your last bowel movement?
This morning.
Okay, and can you tell me what it looks like? Was it soft or loose, or was it normal and firm?
It was normal, firm.
Okay, and what color was it?
Brown?
Okay. If there was, this is when you would want to assess and make sure that they didn't notice any darkness in their stool. If their stool was closer to black, there's a chance that there was a trace of blood in their stool. Okay, perfect. You can sit up. I'll help you.
Oh, but thank you.
Okay, so she let me know that she hasn't had any problems using the restroom. Everything is normal. For urination, when was the last time you urinated?
Probably an hour ago.
Okay, and do you feel any pain or anything like that?
No.
Okay, and you're drinking enough water. If there was a dark color to your urine, it's probably because you're a bit dehydrated.
No.
Okay, and if it was cloudy or anything like that, there's a chance that there's an infection. But you said you didn't feel any kind of pain. Usually that would be the first signs of a UTI if you had a painful or frequent urination.
Okay. No.
All right, perfect. So the last thing I'm going to do is your musculoskeletal exam. So what I'm going to have you do is I'm going to, hi Lucy, I'm going to assess 2 joints. Mom stole them, it's fine. Mom's going to assess, oh God, I'm going to assess 2 joints in your upper extremities, and I'm going to assess 2 in your lower. Have you had any problems with any of your joints?
No.
No surgeries, no nothing I need to worry about?
Mm-mm.
If she had a joint, say her shoulder or something like that, that she had had a previous surgery or anything done on, I would avoid that spot. I wouldn't want to test that joint. I would want to move on to the next one. So I'm going to start with your elbow.
Okay.
And what I'm going to have you do is I'm going to put my fingers here and I'm going to have you flex and extend. Okay? So flex and extend. Do it one more time. Perfect. And now I'm going to have you do it against my resistance. Perfect. And then extend against my resistance. Awesome. Okay. Moving on to her other side. There were no signs of crepitus or any kind of cracking or any problems with that joint. Moving on to this side, I'm going to have you do the same thing. Flex.
This way.
And extend. And do it one more time for me. And then you can do it against my resistance. And flex against my resistance. Perfect, okay. And I'm gonna check your wrist next. So what I'm gonna have you do is I'm gonna have you flex, extend, and hyperextend. Perfect, okay. So I'm gonna put my finger here so I can feel the joint, and I'm gonna have you flex, extend, and hyperextend. And now flex against my resistance, okay? Hyperextend against my resistance. Awesome. This one, and none of these are causing you any kind of pain.
Mm-mm.
If I'm testing one of your joints and you feel any kind of pain or anything like that, just let me know.
Okay.
Now I'm gonna have you flex, extend, and hyperextend, and then flex against my resistance, and extend against my resistance. Perfect. Once again, there was no crepitus or any kind of sounds or cracking that alerted me that there would be a possible issue. And I'm gonna check your knee next. So what I'm gonna do is I'm gonna put my hand here.
Okay.
You're already flexing, and then, yep, extend and flex, and extend against my resistance, and flex against my resistance. Perfect. Okay, and extend, flex, extend against my resistance, and flex against my resistance. Perfect. Okay. And the last thing I'm going to do is your ankle. So what I'm going to have you do is you're going to plantar flex and dorsiflex. Perfect. Okay, do it one more time. Awesome. And then plantar flex against my resistance, dorsiflex. Awesome. Same thing on this side, plantar flex, dorsiflex against my resistance, and against my resistance. Perfect. Okay. So there was no signs of crepitus, or there was no complaints of pain or anything like that in any of her joints. Everything had their full range of mobility. Nothing is concerning or not able to extend or flex properly. So that's what I was looking for. Next thing I'm going to do for my musculoskeletal is I'm going to have you stand up so I can assess your gait and your balance. So what I want to have you do is you can start over here, okay? And I'm going to stand, hang on, I need to come over here. So I'm going to assess your gait. Just walk regular for me. Perfect. And then turn around and walk back. Perfect. Okay. If I had a patient where I was concerned about them being able to walk on their own, I would be providing them stability by holding them by their shoulder, making sure that if they were to trip or fall, I was there to catch them. Her gait looks even, sturdy. I wasn't noticing any kind of leaning or unbalance at all. Next thing I'm going to do is I'm going to test your balance. So we're going to do tandem walking.
Okay.
What I'm going to have you do, hang on, let me. Okay. So what I'm going to have you do is you're going to walk with your feet one in front of the other. Okay. Okay. Come in. And then just one foot in front of the other. Okay. perfect. If I wanted to do another one, it would be the Romberg's test. She would stand with her feet together, hands by her side, close your eyes, and my hands are by your side, so if you felt any kind of imbalance, I would be ready to catch you. Perfect, okay. There was no swaying, there was no concern for fall or anything like that, so that's great. The last thing I'm gonna have you do is sit down and I'm gonna do a pain assessment. So, all right, so are you having any pain today?
My ankle is a bit sore,
Okay,
a little bit, yeah.
all right. If you had to rate the pain on a scale of 1 to 10, what would you rate it?
Probably a 3.
Okay. Do you know what caused it? Did you trip or did it just kind of come on?
Yeah, I tripped over the dog.
Okay. So if you had to describe the pain, like the quality of pain is what we would call it, how would you describe it? Is it a throbbing? Is it a burning? Is it a stabbing? Or is it just a dull ache?
Throbbing.
Throbbing, okay. Do you know anything that helps alleviate that pain? Like ice or rest or
Maybe some elevation.
some elevation, okay.
Mm-hmm.
And what makes it worse? Anything that disturbs the pain or
Pressure.
pressure, okay. Perfect. All right, well, I'm going to write everything down and document the doctor is going to be in very soon, okay?
Okay, thank
All
you.
right. Wait, it's not stopping.
No, make it stop.
Hang on. Wait.
Your mom.